engineer, and he's the science advisor for Focus for Health. And he is a man who is literally walking his talk and showing up for truth for everyone, every single day. Brian Harper.
Thank you so much. I want to thank you all for coming out for such an important event today, and for all the work that has gone to fight against the medical tyranny that will be caused if SB277 becomes law. So for those of us with vaccine-injured children, it's an insult and a lie to say that vaccine injuries are rare and minor. Unfortunately, it's quite the opposite. Vaccine injuries occur frequently and quietly, robbing families of their happiness, livelihoods, and their very soul, as so many of these injuries lead to lifelong debilitating illness. And I want to thank you for all the families of wonderful special kids represented here. You're my heroes. For refusing to be quiet, and for fighting for the parental consent rights of Californians. Okay, so, heard any good phone conversations lately? Okay, so if you look at the VAERS database, that's a CDC's own database where they record vaccine adverse events. Just for grins and giggles, yesterday I looked at the database and I found that since 1990, there have been 500,000 reported vaccine adverse events in the United States. 500,000. Now, when you look at how that's reported, that's only 10% of the actual vaccine injuries that occur in the United States. So since 1990, you know, Richard Penn is full of it. Yes. There have been at least 5 million vaccine injuries.
Yes.
So, and if you look at reported vaccine injuries for the year 2014 alone, you'll see 28,724, of which 328 were considered life-threatening. That's just in 1 year. Okay. Now, and if you look at the total number of deaths recorded among infants and toddlers in the vaccine adverse events reporting system, there's 3,311 children who have given their souls just for the greater good. The total number of children and adults permanently disabled or disfigured, 11,288. So now, if we consider the inspiration for vaccine mandate fever across the United States and how it's hit state capitals across the country, this was a garden variety measles outbreak with ground zero being Disneyland, where over a period of 3 months, 159 children and adults contracted the measles and all recovered by April 2015. This is the major year for measles, by the way. It happens to be a relatively minor year for measles. Now, no deaths, no permanent disabilities, all recovered. Curiously, over the same time period, 346 people in the U.S. reported adverse events from the MMR vaccine alone, including 16 serious adverse events and 1 death. It is safe to say that vaccines are killing off our population at a higher rate than infectious disease. Something is gravely wrong with this picture. SB277 has nothing to do with protecting children. It has everything to do with increasing the profit margin within pharmaceutical companies. Vaccines are big business, yielding about $25 billion in sales per year. Wow. With that number soon increasing beyond $100 billion because pharmaceutical companies have plans, given over 270 new vaccines that are going to be in the development pipeline. Now, let's talk about William Thompson. The fox is guarding the hen house. Our own CDC, which is supposedly there to assure vaccine safety for the U.S. public, operates not as a public service agency, but instead as a corporation. You see, as told to me directly by the CDC whistleblower, Dr. William Thompson, the CDC buys and resells $4 billion worth of vaccines to the American public per year through the distribution of states' public health departments. If vaccine uptake is high, the CDC maintains profitability. sound like an agency to me. If vaccine uptake is low, the CDC loses money. Simple economics. Economics which trumps the health of the children and the adults of the United States. Dr. Thompson also described to me the incredible pressure within the CDC to not find a link between vaccines and adverse outcomes. As he stated, when the CDC scientist finds an adverse event link that they don't want to report, they get together in a room somewhere and spend hours brainstorming and working until that adverse event can go away. Never mind what the real science says, the CDC mantra is to promote vaccination at all costs. Woo! The reward for this? A lucrative position within a vaccine manufacturer after your tenure as CDC is up. Many, if not most, CDC scientists end up retiring to careers within pharmaceutical manufacturers, health insurance companies, or healthcare companies. Generally with a substantial increase in pay. Look at Dr. Julie Gervin, who is most likely co-authored the legislative plans of the vaccine mandates we're seeing in state legislatures today. She was the director of the CDC from 2001 to 2008, and then in 2009 became the head of the vaccine division for Merck. Dr. Gervin even recently sold her stock options from Merck, exactly 38,368 of them, making her a cool $2.3 million in the process.
It's a shame.
We are gathered here for such a time as this and stand in the gap to prevent medical fascism in our state. I want to thank each family represented here, you all who have said enough is enough and will not let our country sacrifice children for profits. Let's go forward and defeat SB277. I believe in consequences for our actions here on Earth, and that history will shame those guided by greed and cowardice behind this demonic action against the health of our children.
Thank you, Brian Hooker. Next up, we have a woman who's flown down from Seattle. She's a